Ever had that weird feeling in a finger or toe where it feels less like a normal digit and more like kind of a small, swollen sausage?
Yeah, that sort of uniform puffiness, not just a typical ache.
Exactly. If that sounds familiar, you're in the right place. Welcome to the deep dive. Today we're focusing on a condition known for exactly that look, dactylitis. We're working from our Dactylitis, Notes for Revision. It's a really concise guide, packed with the essentials.
Right, a good solid base for revision.
Our mission today, to pull out the absolute must-know info on dactylitis for, really effective learning and recall.
So we're covering the definition, the causes, risks, how it actually happens, what else it could be.
Yeah, exactly. Who gets it, what it looks like, how doctors check for it, management, and of course the outlook. Let's get started.
Okay, so first up, let's pin down the definition. In simple terms, what is dactylitis?
Right, so the notes are clear. Dactylitis is inflammation and swelling, but the key thing is it affects the entire finger or toe.
The whole digit.
The whole thing, giving it that very distinctive sausage-like appearance. It's not just one swollen joint. The whole digit puffs up.
And that sausage digit, it's often a big clue, isn't it?
Yeah.
Points towards something else going on.
Definitely. It rarely just happens on its own. The notes really highlight its connection to underlying conditions.
Like psoriatic arthritis, reactive arthritis.
And sickle cell disease, too. So seeing that sausage digit should make you think, okay, what's the underlying cause here?
Exactly. Which brings us neatly to etiology, the why. What actually kicks this off?
Good question. What do the notes say about the cause?
Well, like a lot of these inflammatory things, the exact trigger for dactylitis itself isn't fully understood. It's a bit complex.
Okay.
But we do know the conditions it hangs out with, the main associations.
Which are? Give us the main players again.
So number one, psoriatic arthritis, then reactive arthritis. And remember, reactive arthritis often follows an infection. That's an important link.
Right.
And sickle cell disease. What's key is how the inflammation in these conditions isn't just confined to the joints. It spreads, it affects the tendons, the cords connecting muscle to bone and all the soft tissues around them. It's this widespread inflammation throughout the digit that leads to dactylitis, like a wave of inflammation.
So it's like everything inside that finger or toe gets inflamed together.
Pretty much sums it up. The notes also mention some rarer causes, tuberculosis, sarcoidosis, syphilis. Less common, but worth keeping in the back of your mind if the usual suspects don't fit.
Good point. And the notes specifically mention spondyloarthritis here, too. How does that fit in?
Yes, that's a key term. Spondyloarthritis is sort of an umbrella term for inflammatory conditions that often affect the spine, but also peripheral joints and, crucially, the entheses.
Entheses, that's where tendons attach to bone, right?
Exactly. And both psoriatic arthritis and reactive arthritis fall under that spondyloarthritis umbrella. So their strong link to dactylitis makes sense because they tend to cause inflammation in those specific spots: joints, tendons, entheses.
Okay, got it. So we know what it is and the conditions it often travels with. Who's more likely to get this? What are the risk factors?
Well, the biggest risk factor, according to the notes, is pretty straightforward. Already having one of those underlying conditions.
Psoriatic arthritis, reactive arthritis, sickle cell disease.
Exactly. If you have one of those diagnoses, your risk of dactylitis is significantly higher.
Yeah.
It just makes sense, doesn't it?
Yeah, if you've already got that kind of systemic inflammation going on.
Precisely. And it's not just about having the condition. The notes mention genetics playing a role, especially in psoriatic arthritis.
Oh, interesting. How so?
Certain HLA genotypes, HLA is human leukocyte antigen, part of our immune system's recognition system. Certain variations seem to increase the risk of dactylitis, specifically in people who already have psoriatic arthritis. So a bit of genetic susceptibility can be involved too.
Right, fascinating how genes can nudge the risk up or down. Okay, let's get down to the nitty-gritty then. What's actually happening at like a biological level to cause that sausage swelling? The pathophysiology.
Okay, so we know dactylitis stems from inflammation inside the digit. The notes pinpoint the key players, the joints, the tendons around them, and the soft tissues.
And this isn't just minor irritation.
No, it's a full-on inflammatory response driven by the immune system. In those underlying conditions, the immune system basically gets its wires crossed and attacks healthy tissue in the digit.
Okay.
This triggers the release of inflammatory messengers called cytokines. Think of them like alarm signals shouting, inflammation here.
Right.
These cytokines ramp up the process, causing more blood flow, fluid leaking into the tissues. and that's what gives you the characteristic swelling, the enlargement of the whole digit.
So it's our own immune system causing the puffiness.
In essence, yes.
Yeah.
In conditions like psoriatic or reactive arthritis, it's mistakenly targeting the body's own structures. And this inflammation, as the notes point out, directly causes the main symptoms, the pain, the stiffness, and difficulty using the finger or toe properly. Functional limitation.
Makes sense. A sausage finger probably isn't going to be very cooperative or comfortable. Now, someone shows up with this. How do doctors figure out if it is dactylitis and not something else that looks similar? What's the differential diagnosis?
That's a critical step. You've got to rule out mimics. The notes give us a good list. First, think infection. Could it be cellulitis, a skin infection? Or even osteomyelitis, infection in the bone.
Okay, infection. What else?
Trauma is a big one. A bad stub toe, a crush injury that can definitely cause swelling.
Sure.
Then you have the crystal arthropathies, gout and pseudogout. Crystal deposits causing intense inflammation.
All right, the crystals.
And finally, just other types of arthritis that might cause swelling in fingers or toes. You need to consider those too.
That's quite a few possibilities. Is there an easy way to remember those for revision? A memory aid?
Let's try one. How about ITCGOA?
ITCGOA.
Yeah. I for infection, T for trauma, C for crystals like gout, G for general other arthritis, ITCGOA. Maybe that helps categorize them in your head.
ITCGOA. Infection, trauma, crystals, other arthritis. Yeah, that's pretty handy, thanks. Okay, zooming out a bit. How common is dactylitis? What's the epidemiology look like in the UK based on our notes?
Well, the notes say there isn't one single number for the UK overall. Its frequency really mirrors how common those underlying conditions are.
Because it's a feature of those conditions.
Exactly. But we do get a specific figure for psoriatic arthritis. The notes suggest that quite a chunk of people with psoriatic arthritis, somewhere between 20% and 40%, will get dactylitis at some point.
Wow, 20 to 40%. That's quite high.
It is. It really highlights that strong link. And for sickle cell disease, the notes mention it's seen more often in populations where sickle cell itself is more common, like people of African or Mediterranean descent.
Okay.
And in sickle cell, dactylitis, sometimes called hand-foot syndrome in young children, can actually be one of the very first signs of the disease.
Right, so prevalence really depends on the underlying condition's prevalence. Now, if someone comes in, what specific things does a doctor look for? What are the telltale clinical features?
The classic sign, the one that notes really hammer home, is that swelling of the entire digit, that sausage-like appearance. It's usually quite uniform, not just bulging at the joint.
That's the main visual clue?
Absolutely. And along with that, you'll typically find pain and tenderness when you touch or move the digit, plus limited range of motion difficulty bending or straightening it fully.
So sausage look, pain, stiffness, those are the big three.
Those are the core features, yeah. But the notes also mention you might see some redness or warmth over the swollen area, maybe even some subtle skin changes. It's usually that whole picture together that makes you suspect dactylitis.
Got it. So the doctor suspects dactylitis based on these signs. What next? How do they confirm it and figure out the cause? What investigations get ordered?
Right. Investigations have two main jobs here. One, confirm inflammation involving the whole digit. Two, hunt for that underlying cause. The notes group them into imaging and blood tests.
Okay, let's talk imaging first. What kind of scans?
X-rays are often done first. They look at the bones and joints, check for damage, especially if it's been going on a while, or rule out things like bad osteoarthritis.
Makes sense.
Ultrasound is really useful too. It's great for looking at soft tissues like the tendons and can clearly show inflammation throughout the digit.
So ultrasound gives a good view of the soft tissue swelling.
Yeah, exactly. And if things are still unclear or they need a really detailed picture, especially of deeper structures, an MRI might be done.
Okay, X-ray, ultrasound, maybe MRI. What about blood tests? What can they tell us?
Blood tests look for signs of inflammation floating around the body, systemic inflammation. Things like ESR and CRP, the inflammatory markers, might be up. Plus, specific blood tests can help point towards those underlying conditions. You might check for rheumatoid factor or anti-CCP antibodies to help rule out rheumatoid arthritis, or maybe HLA-B27 if spondyloarthritis is suspected.
And for sickle cell.
Definitely need specific tests, like a blood film and hemoglobin electrophoresis if sickle cell is on the cards. So bloods help see the bigger inflammatory picture and find clues to the cause.
Right. So once you've got the diagnosis, maybe identified the cause, how do you treat it? What's the management strategy?
The main goal, as the notes say, is twofold. Treat the underlying condition, whatever it is, and relieve the dactylitis symptoms themselves, the pain and swelling. It's usually a mix of drugs and other therapies.
Okay, let's start with the drugs, the pharmacological side.
Often the first step is NSAIDs, non-steroidal anti-inflammatories.
Ah,
They help with pain and bring down some inflammation.
like ibuprofen.
Yeah, things like that. But for the underlying inflammatory arthritis, like psoriatic or reactive, you need DMARDs, disease-modifying anti-rheumatic drugs. These actually target the disease process itself.
To get the root cause under control.
Exactly. And if those aren't enough, or for severe cases, you might move to biologic agents. These are more targeted drugs that block specific inflammatory pathways. And of course, simple painkillers can help manage discomfort day to day.
So a layered approach with meds. What about the non-drug therapies mentioned?
Physical therapy is important. Gentle exercises can help keep the digit moving, maintain function, and prevent stiffness.
Right, keep it mobile.
And sometimes, splinting the finger or toe can help. It provides support, reduces pain, and just gives the inflamed tissues a chance to rest and calm down.
Makes sense. Support and gentle movement. Now, thinking long-term, what's the outlook? What's the prognosis for someone with dactylitis?
It really depends on that underlying condition and how well it's managed. That's the key message from the notes.
So if you treat the psoriatic arthritis or the sickle cell effectively,
Then the dactylitis often improves significantly or might even resolve completely. Good control of the root cause equals a better outlook for the dactylitis.
but it's not always straightforward.
No. The notes acknowledge that sometimes dactylitis can be stubborn, it might recur or persist even with treatment, and that can lead to chronic inflammation and potentially, over time, damage to the joints in that digit.
Which brings us to complications. If it isn't well managed, what are the potential long-term problems?
Yeah, if it becomes chronic or isn't controlled, several issues can arise. The notes list things like chronic pain, which obviously impacts quality of life. Joint deformity is another risk. Persistent inflammation can physically damage the joint structures, and that leads directly to functional limitations. Difficulty gripping, walking, whatever that digit is needed for.
Which must really affect daily life.
Hugely. Reduced quality of life is explicitly mentioned as a consequence, and the worst-case scenario is long-term joint damage leading to disability.
So it really highlights the need for prompt action.
Absolutely. That's the final takeaway on complications in the notes. Early recognition, getting the right treatment started quickly, and regular monitoring are crucial. It's all about preventing these long-term issues and getting the best possible outcome.
Okay, let's wrap this up. What are the absolute key points about dactylitis to take away for revision?
Right, the big ones. Remember the definition, that sausage-like swelling of the whole digit?
Got it, sausage digit.
Know the key associations. Psoriatic arthritis, reactive arthritis, sickle cell disease. I think it's those three.
Okay.
And finally, understand that managing it effectively and preventing those nasty complications all comes down to tackling the underlying cause. Treat the cause, treat the dactylitis.
So that swollen finger or toe isn't just a local problem. It can be a really important signpost for something bigger happening systemically.
Exactly. It really shows how connected everything is and why you need to look beyond the obvious symptom.
A great reminder. Well, if you want to cement your knowledge on topics like this for the MSRA, definitely check out passthemsra.com.
Yeah, lots of great resources there.
And also head over to freemsra.com for even more free revision tools.
Both are excellent sites for MSRA prep.
Great. Well, thanks for diving deep into dactylitis with us today.
My pleasure.
Until next time.